I'm Dr. Goldson. This is my good friend Jabalani. What we wanted to discuss is Jabalani's condition, which a lot of people actually are affected by, which is hip degeneration. Jabalani and I were working together. It's been about a year, maybe a year and a half now. He was coming in with complaints, low back complaints, but also some hip complaints. We found that there was some degeneration in the low back, which we thought that were affecting the hip, which it was from a radiating pain standpoint, but all along there was still degeneration in the hip going on. So what we're looking at here are the x-rays of the hip. This is considered a pelvis x-ray. So if you're having pain, and the whole goal of this information is to help somebody at home who's having similar pain and trying to avoid a total hip replacement. What do you do from a chiropractic standpoint, physical therapy standpoint, to avoid a total hip replacement? So first, when you start having pain, they're going to take an x-ray of your hip. Now, what we're going to focus on is this right hip where Jabalani has most of his pain at. Can you describe what type of pain you feel in the hip?
When I step up, walking upstairs, there was a sharp pain in my groin, and I also had like radiating pain on the outside of my hip and going down my bottom.
Those are first signs. The sharp pain is usually because there's some degeneration in the hip, and as you have bone on bone pain, the pain is very sharp most of the time. And what that looks like on x-rays is this. You'll see this is the right hip with the ball fitting in the socket. This socket is narrow on the inside, so that sharp pain that you'll have around the groin is typically from that area. And that comes with emotion. And if we use this to diagram that, when you have hip motion, if there's degeneration inside, the bones are going to jam, causing sharp pain.
So it's bone on bone
It's bone on bone.
So how is there so much space?
That's a great question, man. Because the hip is a 360-degree ball. It's a sphere that sits inside this socket, all right? So this sphere, when you're looking at it on x-ray, you're getting different parts of the sphere with different angles of the x-ray.
Okay.
So on this one is a straight A to P shot. This shot is looking at this hip straight through the joint. And we can see clearly that we can see degeneration on probably what's probably more considered more the front side of the hip, right? The question usually is this the front or the back of the hip? Because an x-ray is a 2D image of a 3D structure, you're seeing both at the same time. That's why we have to do, anytime you get an x-ray done, you at least have to have two x-rays. Why? Because you have to have at least 90-degree opposing views. Because if I take an x-ray of my arm, and the fracture and the break is going this way, if I take the x-ray this way, you will never see it until I take it this way or rotate it this way at a 90-degree angle this way, that I'll see the fracture going this way, if you understand what I mean. So on this side, you've rotated your hip outwards, so you're seeing a little bit more of the back side of the ball and socket. More of the front side of the ball and socket, more of the back side of the ball and socket. One thing that hasn't changed is this. Check this out. Look at the bone spur right here.
Okay.
That's that bone spur.
That's what we saw over there?
That's the same bone spur right here.
Oh, okay.
Right. That same bone spur.
So that's actually on the leg bone.
That's on, right. That's on the femur. Femur, right there.
Yeah.
Imagine your hip rolling in and out with that sharp angle at the bottom. It's going to give you sharp pain along the groin. Sharp pain along the groin. Sharp pain along the groin.
And then impinge on any nerves that are running there also.
The nerve, but the soft tissue in itself is uncomfortable.
Okay. Yeah.
The nerve will give you pain radiating down the leg. That will just give you sharp pain that'll avoid you putting weight onto that side.
Yeah.
What do you do about that?
I got all of that.
You got all of it. Now, some people at home will be watching this and their x-rays are a lot worse than this. You are doing good in the sense that you have good bone density. Some people have stopped moving. Some people have stopped because the pain that they're having in their hip, they can't really walk because of so much pain, which they stay in the chair, meaning they lose the bone density. Now, if the bone density starts to go away and you have arthritic changes, now we're talking about osteoporosis or osteopenia, same thing, and we're talking about the pain. You're doing what's best at this point. You're staying active, you're staying mobile, but you have to know where what's there. That's there. Our goal is to avoid surgery. Some people look at it and say, well, I just have to get a total hip replacement, and not necessarily all the time are they wrong. It's what they can do actually to activate the muscles to stabilize the joint and minimize the pain.
Reduce the pain.
You got it. The hip and pelvis is a very complex joint, if you will, because not only do you have the pelvis, which is your hips, your pelvis is really made up of 3 bones: right hip, tailbone, left hip, where it fits together. These are considered the SI joints. The problem when you have hip pain that's been affecting you for a long time, you're going to start putting a lot more pressure on the hip that doesn't have pain. For instance, if you have pain on this side, you're going to start leaning to the right and putting more pressure on that side, which can start to wear and tear the SI joints, the pelvis joints themselves. And if it doesn't necessarily cause wear and tear, these joints aren't really highly mobile joints, but you will start to notice shifting, like we see on your x-ray.
So the whole hip twists.
It starts to rotate in. Because your body's going to do a little bit of any and everything
to compensate.
You got it. Because when we look at your left pelvis, you can see it's wider here compared to the right side. And that's as a result of it rotating around the pelvis to adjust for where the pain is. So really the mechanics of your hip, it's trying to change the angle in the mechanics of your hip so it takes off for the pain. Hence the rotation.
And why my foot is always tending to one
rotate,
turn,
roll
turn
out. Because your pelvis is rolling out.
Yeah.
Right. So what we're treating right now primarily in our stretches is not only just tight muscles, but the majority of our joints in our body are called synovial joints, which means the joint itself is being bathed in synovium fluid. That's the fluid that lubricates our joints. What keeps the fluid on the inside and near the joint is the joint capsule. So it's most of our joints have this capsule that surrounds the joint, which is a pressurized joint, which is why we can crack our knuckles, because the pressure escapes from that capsule. But if we don't have mobility in that capsule, we have less production of synovial fluid. So the cells on the inside of that capsule are stimulated to produce fluid and bathe the joint when there's motion. So
exercise is good.
Exercise is great because it encourages motion. A lot of what we hear most often is, I have so much pain, I can't move, I can't exercise. Which is true, I get it. But we have to find the right level of exercise for you and build up from there. Even if it's just a stretch. 4, 3, 2, 1. Avoiding hip replacement. This stretch you can do at home. Bend one knee. Let the knee drop out to the side. As far as it can go, comfortably. I'm going to ask Jabulani to take his hand and just push down that knee and take the other hand and keep this hip down, stretching across the hip joint. That groin tightness that he talked about before, the sharp pain, we're stretching that area of the capsule to loosen it up at this point. So this is a stretch that you can do at home if you're having hip pain, to start loosening up your hips a little bit.
Is it important to exercise the same thing on the other side too?
Good question. I was just going to say that. You actually want to do both sides.
Okay.
It's good to do both sides. One, you can see where your limits of function are. And we can see on this stretch much further on this side than the other side. We still want to activate the other side because we don't want to create imbalance. We know that this is our target for our affected side at this point. So yes, you want to do both sides. As we stretch this hip and the capsule that surrounds the hip, what's going to happen is we're going to get more synovial fluid to bathe the joint. Hence, by that we'll develop a little bit less pain as well.
And more flexibility.
That's the goal. Today it was a good day.
Yeah, but I'm feeling it now.
Right, but you're gonna feel it because there's gonna be an increase of inflammation.
Yeah. So
when we get off of exercise, when we finish doing what we're doing, we're gonna set up with ice because ice settles down the inflammation along with the pain cream. 2, 1. This is day 1 stretch, so I expect over the next 30 days we're gonna get a lot better at that. It's best at this point to look at what the left hip looks like. In Jabulani's case, which is a blessing, there is more cartilage in between the bone and the hip, so you can see that there's space around the rim of that bone. Not bone on bone. If we go back to the right, there's a sharp pain. It just looks different. We call that morphology of the bone. It's the shape is different, the shape changes. The body changes as the amount of pressure that's put on it. So once you have an injury to the hip, that goes back, and Jabulani explained to me it was a work-related injury at some point that started some cramping in the hip, and that progressively got worse. What more than likely happened, the hip became offset and out of alignment, allowing it to have more wear and tear because it's not in the full socket. With that extra pressure, the body builds up more bone, and on x-ray it looks like this.
With all the cartilage gone.
All the
cartilage in there.
And then on the top of it, you see we have extra bone pressure there. When you're looking at x-ray, anytime you see increased whiteness on x-ray, means that there's extra more pressure in that area. So that's a good way to find out where there's pressure. So in this particular case, this would be an x-ray that a surgeon would look at and say, you're having so much pain, or there's been so much degeneration, we would have to, a total hip replacement would be warranted. So in this case, it would definitely be something that a surgeon would look at and say is warranted, but avoidable at this point. The goal is, over the next 30 days, is work with Jabulani on stretches that are going to produce more motion in this hip, strength, which is going to increase the stability around the hip. When we start working on the glute muscles, the buttock muscles, the thigh muscles, now there's more stability there supporting this hip. While this degeneration may not go backwards, and we don't expect it to, the stability around the hip will allow for less degeneration to occur and less pain to occur. And that's really what we're trying to avoid. When someone asks me, hey doc, what do you think about surgery? I don't care if it's back surgery, I don't care if it's hip surgery. My normal question is, how much pain are you having and what have you tried?
Yeah.
Because if the pain's so bad that you can't tolerate it, and you've done your exercises, you've done your stretches, we've done chiropractic adjustments, and it hasn't gotten better, that's a different conversation. But if we haven't tried it, if we haven't done the non-invasive approach with the stretches and exercises, then I would say give that a try. And if you can't tolerate the pain, different conversation. But that's not where we're at. So the next 30 days, we're going to be working out, we're going to be doing exercises, and we're going to effectively try to rehabilitate this hip joint as well as the low back joint. So stay tuned. If you have questions, post the questions. Jabulani is going to be answering a lot of the questions, and we want to see what his process is and how he's feeling along the process. And in the matter of function, how are we improving our function and how are we decreasing our pain? Dr. Goldson, look forward to seeing you.